Okay, cool. Let's get started. Hi there. My name's Om Mahida. I'm Vice President of Product at Medcrypt, and I'll be your host for your webinar today with our friends at Netrise. Today we're talking about SBOMs and the upcoming FDA RTA enforcement, and a couple of things we've experienced in the field over the last couple of years related to med devices and IoT devices in general. A few housekeeping items before we dive in. If you have any questions, feel free to submit them using the Q&A feature, and we'll at the end of the webinar get to them and answer them live. And then if there's any follow up needed from Tom or me, we'll contact you via email. I'm excited today to be joined by Tom Pace, CEO of Netrise. Tom, would you like to give a quick intro?
Yeah, sure. Thanks a lot for having me. Really looking forward to having this conversation with you. So, co-founder and CEO of Netrise. Prior to this, I was the global vice president of enterprise solutions at Cylance, where I did all manner of things. But for the purpose of this conversation, I oversaw all of our IoT firmware and embedded system engagements. Prior to that, I worked at Department of Energy, where I also had a number of roles and responsibilities. The primary one that kind of informed what we're doing today is around industrial control system security. And then before that, I worked at a bank, the Northeast PNC Bank, and was in the United States Marine Corps prior to that.
Awesome. A very extensive experience in cybersecurity and IoT. So love to hear a bit more about that as we get into the webinar.
Sure thing.
Cool. So let's just dive in. I mean, we're using interesting software today. Tom, do you want to just like resize your video here so it's we're kind of equal parts?
Why not?
Sweet. Looks good to me. Cool. Diving into like what we've been seeing. I mean, there's been a lot of chatter around the FDA, other agencies, really kind of getting more serious about cybersecurity. We saw, the White House a couple years ago released an executive order on SBOMs. There's been a lot of follow up, a lot of work within different agencies in the federal government. Tom, from your experience working at like kind of on that side of things, what changes have you seen, and what things have really like shifted, right, from what like the federal agencies actually like what agencies are actually expecting from contractors, from people selling their products and services into them.
Yeah, I think you have such a broad spectrum of adoption, especially currently, where you have some organizations that frankly just want visibility for their own sake.
Hmm.
So they're not even necessarily using it from a contracting vehicle perspective or a third party risk perspective, though folks are doing that as well, from either a in the government or like just commercial entities as well.
Hmm.
It's really across the board. That being said, you just have this continuous um, onslaught, whatever you want to call it, of executive orders, binding operational directives, the national cybersecurity strategy, the national cybersecurity implementation plan. You have all of these things that continue to call out these problems around software transparency, secure by design, and how are we going to do that? Pushing back on the device manufacturers to attempt to solve as many of these problems as possible, but also drive that adoption from the enterprise and the folks that are actually using these. So it's really a multifaceted approach, and it's fun to be kind of on the tip of the spear from that perspective and seeing how this is all shaping up.
Yeah, definitely. It definitely feels like, right, there's a lot of change occurring today, and a lot of people are trying to really modernize their current cybersecurity practices because we've seen a lot of things over the past couple of years where like critical infrastructure was impacted, right, by cybersecurity incidences. So here in Medcrypt, we're very much focused a lot on healthcare and medical devices and helping device manufacturers like secure their devices, and a lot of our products and services focus on that. So something we've been working closely with our customers is, the FDA got additional regulatory authority to enforce some of the cybersecurity best practices for med devices when med device manufacturers are submitting new devices, submitting updates or changes. The FDA is actually requiring new requirements that are specifically just around cybersecurity versus before it was kind of a patient safety issue. So it's a shift we've seen with the one particular agency. Um, and it's something I kind of want to talk a bit more about is like, so here at Medcrypt, we talk a lot about, how do we make the medical device itself secure, right? Like what can we do in terms of like working with device manufacturers and how they're designing the next gen device. What can they actually incorporate in terms of like products or solutions to secure that device, um, and enable things like secure communication, code signing, but also like transparency, right? Like transparency into what's actually shipping with this device, what's actually running on here. When that device is in the field for 5 or 10 years, or what's actually going on, right, in terms of like security issues and monitoring for that. But so like we very much have a focus on like how to help a device manufacturer kind of be a team embedded there, right, and helping them secure their devices. And one of the things, Tom, when we met in in San Diego a couple of weeks ago, and you were kind of going over your product suite and your approach and the things you've seen. One of the things I really like, kind of like a light bulb went off, was like you guys have a great product and solution from the side of like you know you might have shipped a device, but and you might have some assumptions on what you did for security, but you're like, well, let's go actually test that, right? Hypothesis that it is a secure device, right? You're shipping with secure code. You're shipping with, really, you're following best cybersecurity practices. I'd love to hear a little bit more about some of the like, generalized, like things you've seen with some of your work, both like at Netrise and the tooling you guys are providing and the services you're providing, but also like historically, what are like common hotspot or like common areas you've seen device manufacturers both in the medical space and non-medical space, because I think there's definitely common patterns throughout the industry.
Yeah, I think that's exactly right. I think this is a massive horizontal problem, uh, for a handful of reasons. Number one, it's the same stuff that runs on a medical device, runs on a router, runs on a security camera, runs on a car, runs on a satellite, runs on whatever.
Hmm.
There's even though there's a very long tail from a embedded system, embedded operating system, firmware types, all of that. That is certainly true. Uh, However, once you can support a handful of things, you can pretty much cover the vast majority of the types of operating systems and firmware images that run on those devices. So what we find is a lot of people like to get kind of wrapped around the axle about the number of vulnerabilities that are identified and things like that. And there's a concern around, hey, we have a massive vulnerability management problem here. And I just don't think that's the problem that we have. I think the problem we have is a lack of visibility and transparency problem, which then creates a vulnerability management problem. Because if I show you a bunch of vulnerabilities
Hmm.
and then I go back and trace back, like, hey, where did these things come from? And that software component that possesses those vulnerabilities is a decade old. Do we really have a vulnerability management problem? Uh, I think it's pretty clear that we don't. Now, that's also not to say that all components and all things need to be the newest version, perfectly patched, because that's
Right.
also totally unreasonable, right? It's just
Yeah.
never going to happen. And that's fine. That's totally fine. But what's not fine is not being able to make that decision based on having access to all of the data that is capable of having available to you. And this is just not a problem that needs to exist anymore. It just doesn't. So I really compare what we are doing. It's very similar to what kind of the EDR landscape looked like
Hmm.
early on, right? Hey, did everyone need to know every single process that was running on every single device in their environment, like in year number one? Obviously not. Uh, but for the people who did have that desire and did have use cases that aligned towards having access to that data, that was the only solution that could give them those answers.
Mhm.
And that's really where we find ourselves is, you know, if you want to have insight to this, we can provide it. The other thing I would mention, and I know we're talking a lot about SBOMs today, and that's probably the most important artifact from a supply chain risk management perspective,
Mhm.
but it's not the only one, right? We have, we're also enumerating things like public keys, private keys, certificates, misconfigurations that can actually align towards compliance frameworks, things like STIGs, hardening guides. Um, uh, there's obviously certain elements that are within the Patch Act that we can align controls with. And then also things like credentials, right? So let's just imagine in a total fairy tale land where you have a device where all the components are up to date and there are no vulnerabilities associated with it. Okay, that's great. But then there's a set of credentials on that device that are either not even default, right? Not default credentials, but
Right.
just like a set of credentials that are just easy to crack, which we do in an automated way. So this is not a SBOM problem. It's not a medical device problem. It's not a um, Patch Act problem. It's not an FDA problem. It's not in any of that problem. It's a transparency problem and a visibility problem. That's the problem. And once
Right.
you have that, then we can start making whatever decisions we want to make. But to make those decisions, what's really frustrating that we hear from lots of folks is, okay, Tom, you gave me an SBOM. Now what do I do? And I'm like, can we get it to you first? Can
Right.
we
Right.
can we show can we just provide it? And then, people are trying to solve problems way down this line without even having access to the data that we can provide. And I get it. You do want to understand how you can operationalize these things. But, you know, it's like, hey, what am I going to do with this golding that I just mined out of a mountain?
Right.
Well, there's a whole lot of things you can do with it.
Yeah,
But
you need to first get the gold, right? Yeah. Yeah.
effort, and you're going to have to, mold it, heat it up, and pour it into a thing and make it into a whatever. But
Right.
we need to go get it first.
Yeah,
So,
exactly. Yeah, no, you brought up a lot of really interesting points, yeah, I would love to just dive into a couple of them. One of the things
sure.
we've seen is like what you said. I think we've seen variations, right, of people either being really caught up in trying to figure out S bombs. Other times they're getting caught up in, like, okay, I got S bombs, I did a bunch of stuff, I have too much work. It highlighted the transparency highlighted too many issues for me to deal with, right? Like,
Hmm.
and people get like alert fatigue and they're like, well, I need to do these 9 other things that are more important because, right, it's impacting my ability to ship for business, for business value. Um,
Yep.
and I think one of the problems though is things like that end up happening because over time, right, those security issues aren't going away, right? You're outdoing your software, you shipped 10 years ago, right? The components you use to build it, right? They're just getting more. The risk, like the security risk of them, is just increasing over time, right? It's not like the vulnerability count for anything ever goes down, right? Hackers don't
Yep.
stop trying to figure out vulnerabilities and exploits. So it's
Yep.
like super to your point earlier about like the transparency aspect, which I think in the SBOM space is a lot about communicating to like vendors and like customers, um, about what's being used and having transparency that way. I think there's a bit that like the transparency actually helps internal teams a lot too, right? Because everyone's pretty busy, usually trying to ship for business value. Sometimes they might miss, um, sometimes they might miss like one of the hundreds of components they have is old. No one, right? Maybe there's a Jira ticket created for tech debt, but no one we just didn't get to it in the sprint, right, or this release cycle. But I think all that gets lost in the noise, right? And it's difficult to be to really figure out like when should someone actually spend the time updating those older dependencies. And I think that's really where like the transparency side comes through, where it's like, look, we have to acknowledge we're using outdated components or libraries. We need to, make sure it's handled as like you handle any tech debt, right? It has to happen on a regular basis. Um, Dedicate, some cycles or some percentage of your sprints towards like trying to deal with that. But I'm curious, like, have there been other practices or patterns you've seen in terms of like that transparency aspect helping internal teams?
For sure. And listen, you're always going to have people who don't want to go to the doctor because they're afraid of what they're going to find.
Yeah, definitely.
Those people exist, right? Those people are not our ideal customer profile currently, right?
Yeah.
Uh, so the in terms of the visibility that we are providing folks here, it's I always, and it depends if we're talking about an end user or device manufacturer. Let's maybe couch it from a device manufacturer perspective for the most part here.
Yeah.
Uh, there are so many other benefits of understanding what's going on here, right? Let's take an example, the Linux kernel.
Hmm.
That's typically the number one source of CVEs that we identify in devices. And I'm not advocating, once again, that everybody has the newest Linux kernel on all of their devices. Like that's a non-trivial thing to just update kind of arbitrarily,
Right,
right?
it's like super super low level. There's a Linux kernel that comes out every couple of months, right? The cadence or level of effort to keep one to it would be, very difficult. I think
Correct.
even the best of, device manufacturers, like outside of OEM, like, the companies like who actually ship like complete devices, right? Don't always like keep to the latest kernel updates because it's a complex and hard issue.
That's right. And however, the thing to consider is if you're running one from a decade ago, you have to imagine that there are features and capabilities that have been added to the kernel in a decade that would probably be advantageous to you for a number of reasons. Security probably being the least of them. I would hope. I would hope, right? Right? You're going to have optimizations, you're going to have efficiency gains, you're going to have other built-in capabilities that potentially don't require you to use other components that you were previously using. Like
Hmm.
there's a number of all of these things that tend to exist. In addition, from a device manufacturer perspective, the ability to say things like, hey, our average component age in this device is whatever, 4 years old. And now you can start advertising something like that from like a competitive differentiation perspective, which is really what will start to drive this market in a much more positive way. Is hey, we're doing all of these things as you know XYZ device manufacturer, and now everyone else has to answer to that.
Hmm.
So whoever the first organization who decides to come out and put their put their money where their mouth is, they're going to kind of accidentally create the baseline for the industry, and
Right.
that, that's going to be really interesting to see who that is and how they decide to um, kind of communicate that. But also, you have things like incident response, where this is really important. So, the example that everyone uses, and I'm looking forward to something else happening so we can use a different example, uh, is like Log4j, of course, where it's still being downloaded. Like the vulnerable versions of Log4j are still being downloaded from like the open source repositories. That's still happening. So new products are being built with a vulnerable Log4j component, like today.
Yeah,
So
which is crazy to see. But like, what? Why do you think that happens? Though, is it more of a lack of visibility at some company
they don't
because
even
they're just, yeah,
they don't know, right?
yeah.
They do not know. I mean, I've had the opportunity to talk to some of the largest device manufacturers on the planet, show them what we can show them for devices they've manufactured.
Hmm.
And the reaction I get, sometimes it's things like, hey, well, Tom, this must be firmware from 7 or 8 years ago. And I'm like, this is from 2 weeks ago. And the general reaction I get at that point is like, we didn't know, right? So that is indicative not of some level of inability, in my
Hmm.
opinion. The problem here you have is lack of processes, lack of workflows, and a lack of a realization that solutions and technologies now exist in the market that can let you know about these things. And so that's kind of what we drive towards. But the
No,
ability to just answer a question like, do we have this component, and if so, where, saves companies hundreds to thousands of hours a year,
yeah,
conservatively.
definitely. It's yeah, and I think that's a really like something you mentioned earlier, right? Like the aspect that the transparency, bit of like SBOMs, right, is usually driven by from at least in our field, right? And probably because we're both working at cybersecurity companies, right? It's driven from a cybersecurity aspect, but there's a lot of other benefits outside of security, right, that you can get by making sure you're maintaining newer versions of the dependencies you have. One of the less related to SBOMs, one of the things we see a lot of device manufacturers do is like they want to take devices that historically were not connected, right? Um, they weren't connected to the internet or to the cloud, and they want to there's new clinical features coming out, or they could new clinical functionality they could be working on right in the future. If they had connectivity, right, it makes the device better. It allows them to actually like understand what data, right, what's actually happening on the device. Introduce new types of clinical capabilities that historically they never had. And but the thing is, like, now you're taking a device that was designed to not ever be connected to the internet, and that's like a core security control, right? Of like, we're gonna do a bunch of stuff around, like, or we're not gonna do a bunch of stuff because it's not connected, right? We don't have that risk, the threat model for it because it's a non-connected device. But now you're trying to make it connected, or there's a either an update that tries to make it connected, or a next gen right version of it that makes it connected. And now the order of magnitude of work, right, is much higher because not only do you need to worry about how you're enabling the connectivity, but how you're adding a lot more security controls, right? And that kind of goes back to something you mentioned earlier. Is like you could do, security is one of those things that you almost kind of need to do everything right, right? You need to be, you need to like design things from day like one, right? Um, with security in mind, because if you don't, right? If you went and did a really good job on PKI and key management, right? Making sure each device has a unique key pair, right? It has a really good root of trust setup, right? So identity management is really good. You did things like you monitor the device because you're like, it's connected. Let me go monitor it and get logs back on a regular basis so I can see if any suspicious activity happened. Um, but if, and you're making sure you do regular updates, right? There's there over the air updates that are signed. Um, you're doing all this work there, but if in the end of the day your username and password is default, or it's something like someone anyone could figure out, your whole security infrastructure just crumbles to the ground, right? Because that one flaw is enough to bring it all down. And that's definitely something that it's I think it's more and more device manufacturers start realizing, right? Like there are different aspects of security. It's not just like let me run a virus scanner, right, or have a firewall, right? It's really about this holistic approach people need to take. And SBOMs is really just the crawl, right, stage of it.
Yeah, I think that's right. You know, and you're right. This it's a very it's not a level paradigm. Whenever you start talking about cybersecurity, attackers only need to be right once,
Hmm.
and defenders need to be right 100% of the time, and that's just that's never going to work.
Right.
Uh, right? And it's like, do you mean 1% of the time? It's like, no, I don't mean 1% of the time. I mean once.
Once. Yeah.
So it's always frustrating, in my opinion, when I talk to some folks and they say, "Yeah, Tom, well, this thing's not meant to be connected to the internet." And it's like, yeah, it's like I built this car. It's not meant to hit another car, but it might. So that's why we put airbags and seatbelts in it, right?
Right.
Like
Yeah.
we
Yeah.
don't we don't just say like this isn't supposed to happen. So let's just act like it won't. Like that's a really kind of crazy way to think about things. Like, and we don't think about that with other things,
Mhm.
right? We don't. It's just not what we do. Um, so whenever people say, this is not going to be connected to the internet, so we're okay. It's like, okay, well, go do a Shodan search in 10 seconds, and I'll show you all the ones that are connected to the internet. And like, okay, now what do we do? And it's like, well, now it's those people's fault. And
Mhm.
I go, okay, that's fine. But if a if a not if a a decent number of people are doing that,
It's a big enough a risk, and that's actually a really good point, and something we've seen, like, so in the healthcare med device space, right? Historically, the responsibility of security was being pushed, towards hospitals, and hospitals, right? Their expertise is not security, right? They tend to have, I think like there's some stat that like 80% of hospitals in the U.S., right, don't actually have any cybersecurity staffing at all, right? And it's only like the top 10 or 20% that have the resources to have a handful of people on staff. And then if you really dive into the numbers, right? Outside of the handful few up top, most people have one or two security experts. So that's a good, shifting the security issue towards like the end user, like the hospital, right? And even patients, right? If you think about it, is not viable. And we've historically seen the number of ransomware attacks at hospitals we've seen. I think there's been one or two cases where patient safety has been impacted, and that's directly linked to a cybersecurity incident. There's been things like a hospital actually shutting down because of the financial loss, because of having to shut down for a amount of time for a ransomware attack. But we've also seen more recently in the past like 6 months, at least publicly, more people are talking about it, where device manufacturers themselves are being targeted, right? And so like hackers are not just looking at the end user; they're starting to look at actual device manufacturers, and trying to hold devices for ransomware, from that angle. And I think it goes back to something that we've internally talked about at Medcrypt, is that you know assume for a device manufacturer, right, like a creator of a product, to think that the end user is going to secure that device is just a notion that doesn't work, right? And one of the core reasons it doesn't work is that, imagine if Apple or Google or Samsung, when they made their phones and shipped it, were like, hey, the end user, right? They have a secure home connection. We don't need to worry about security on their devices, right? We don't need to worry about that, and that's a flawed, right, mindset, because we know these companies spend billions of dollars on security alone and making sure their devices, right, are secure, and they do really regular updates, and that's a core pillar of one of their selling points, right? Is that the shipping and maintaining secure devices for what we're seeing like 5 years, if not more. Um, and I think that's a mindset that really needs to shift into device manufacturers as a whole. Is that in order to ship better product, in order to gain more trust with their end users, you do need to really bring security right into the forefront of a core pillar of yours, instead of just you know expecting end users to secure it.
yeah, it's a both sets of stakeholders bear responsibility.
Hmm.
So if you use your iPhone analogy, which is a good one, recently they just had a zero-click vulnerability that came out that required everybody to update their iPhone.
Yep.
I have so many friends that they don't even they're running it. Their iPhone gets updated when they buy a new iPhone.
Yeah. Yeah, they always like, yeah, it's like my mom. My mom, once, a couple times a year I see her, I'll be like, give me your phone, let me update it for you, right? So she every
It's
time she
free.
sees an update notification, swipes it away.
It's free. It's hilarious to me why how people don't like do it before you go to bed. You know what I
Yeah,
mean? Like it'll be fine.
right.
Uh, so you have that. You have putting some kind of passcode or something on your phone is your responsibility. So there is this concept of like when you buy something, whether we all like it or not, you are now accepting the risk of that thing.
Hmm.
That's just reality, right? If I buy a car and the brakes go out, someone at the car manufacturer doesn't die. I do.
Yeah.
Like, you know what I'm saying?
Mhm.
So that's just how it goes. If I buy a device from a medical device manufacturer and it has a flaw in it that gets exploited and kills a patient, the hospital is what's in the news, not the medical device. That's just how it goes.
Right.
So the reason I bring that up is you're right. Every hospital is not going to have the people, the process, the technology, the budget, the whatever to be able to identify the risks and all these things that exist. Um, so, with any new technology, you're almost always, not always, but almost always going to start at the bigger organizations and work your way down over time,
Mhm.
right? And what you hope happens here is that from working with the large HDOs that and the device manufacturers simultaneously, that eventually you hit this tipping point where between the device manufacturers wanting to create more secure products for regulatory reasons and market
Mhm.
differentiation reasons, coupling that with going after enterprise customers, which in this case are HDOs, and giving them visibility, which allows them to apply pressure back to the medical device manufacturers. That drives just an overall more secure ecosystem that finds its way down to the smaller HDOs at the end of the day. That's how you hope it goes, right?
Yeah. Yeah,
And
definitely.
that's all you can do right now, right? This idea that you're going to go to some small HDO and be like, hey, we're going to generate SBOMs for your 100 medical devices. They're going to just be like, get out of here, right?
I mean,
And I don't blame
that and, like, if you go, like, "Here's a list of vulnerabilities for these devices," they're also gonna be like, what are they supposed to do, right?" But I definitely agree with, like, like, it's definitely it's a marketplace, right? It's both like the device manufacturers and the end users, like hospitals, you know, both have a part to play in it. But it's also on, right, device manufacturers to make sure, like, if there are security issues or lack of controls in place, that they're doing their best, right, to make it as easy for the end user to be like, okay, I just need to update it, right? I just need to apply a patch. Um, because imagine if right, going back to the iPhone analogy, right, instead of Apple, right, just sending out an update for vulnerabilities, they told you they had vulnerabilities on a device and never did anything about it, right, and you had to figure out how to put a mitigating control for it. Happens sometimes, but that's only in the cases where it's like something came out outside of disclose, like a private disclosure with Apple, and Apple didn't have time to actually fix it. But those cases are far in between. But in this scenario where if Apple wasn't regularly pushing out security updates and making sure the security posture of the iPhone was secure, right, if you would just have a long list of vulnerabilities and exploits on iPhones and wouldn't be able to do anything about it, at least publicly, right? I mean, privately, right? There's a lot of stuff out there, and that's a different
sure.
marketplace. But for like the low hanging fruit, right? It's important.
That's right.
Cool. Go ahead.
No,
Okay,
nothing to
awesome.
add.
Yeah, so this has been a great conversation. We've talked a lot about like experience things we've seen in the device space and around the cybersecurity as a whole. Any around SBOMs and sometimes even like legacy devices. Any thoughts around like what you've seen and where you see the market evolving over the next 6 months and like, to the next couple of years?
I mean, in my opinion, that what we're seeing is this space is super active and there's a lot going on. Uh, I can't imagine how amazing this space would be doing right now if we were operating in an economy that was not a total disaster. Uh, I mean, it's that's one of like the hidden pieces of mayhem here, right? Uh, a company that you know does similar things as us just released a frankly great piece of research around the lack of budget and people spending money on it was related to industrial IoT.
Hmm.
Here's a capability that works. Here's this. So it's going to be just interesting to see how that plays out. I expect, though, as we move forward here and what's going on in the federal government and they keep calling out vendors and breaches that are happening because of devices being the initial access point, you're just not going to be able to ignore these things.
Hmm.
I mean, as it relates to legacy devices, I tell companies all the time, like, just because this is unsupported or whatever, like, we still want it. We still want to understand what exists in here because
Yeah.
you're still, it's like Windows XP, right? Uh, Windows XP was end of life for I don't remember how long, maybe a
Yeah.
year, and then the WannaCry came out, right? And Microsoft issued a patch for
Yeah.
Windows XP, even though it was end of life, right? Well, I mean, obviously Microsoft, everybody, that was an easy thing to figure out, but
Yeah.
in this space, that's not easy.
Mhm.
So, but you should still have visibility to understand, like, okay, listen, we told you guys this is end of life, and it is, and we're not fixing it, but there is a significant risk that now exists in these devices. Here's what devices are affected. Here's what that risk is. Maybe here's some mitigating actions that you can take.
Mhm.
But without having visibility into all of these things at scale, you can't even do that. And that seems like a ill-advised path for us to go down as an industry. That just does not make a lot of sense.
Yeah, 100% agreed. Right, just because you call something legacy out of end of support doesn't mean people stop using it, especially in the
Correct.
device space, right? Like people like hospitals, at least for med devices, right? Like again, the 80% of hospitals that don't have resources aren't spending a lot of their budget updating their devices and rotating them as often as maybe some of the bigger device manufacturers. And so the reality is you have a lot of legacy devices, and it'll take 10 to 20 years for them to cycle out potentially. And do Windows XP, but yeah, I mean, it's not surprising that there's still a lot of devices just in general in the market still running on Windows XP embedded, right? Because they're not. It's just such a order of magnitude, you know, in terms of like expense, right, and resources to cycle to next gen stuff, and operationally can be expensive and difficult. Um, but this has been a great conversation, and love some of the points you brought up. Definitely looking to see transformation happen in the space in the next couple of years, especially around product security teams getting more budget to help really transform their devices, next gen devices, to be more secure, and also identify, and add more transparency to existing devices in the field. Any closing thoughts, Tom?
No, I don't think so. Just that we're super excited to be working with you guys, and we've already seen a good amount of commentary and positive traction from folks as a result of the announcement, and we're really looking forward to continue to see that come to fruition. So we appreciate it, and good times are coming.
Thanks, Tom, and yeah, super excited about the partnership. You guys have a lot of good tech, and that's super relevant and useful in the med device space, and looking forward to leveraging that more and more over the next couple of months and years. All
Awesome,
right,
great to chat with
thank
you,
you,
man. Thanks
Tom.
again.